So welcome guys to another episode. Today we have Rachel Hartley with us, who is an orthodontic therapist. And if you don't know what an orthodontic therapist, hopefully by the end of this video, you will know all about orthodontic therapy and the joys of working as an orthodontic therapist. But first of all, I want to say thank you to Rachel for coming on, spending her time with us away from her partner and her cat. Just so that she can share what life in her shoes is like as an orthodontic therapist. So, no, thank you, Rachel, for being with us today.
Thank you. It's great to be on.
Yeah. So, I mean, tell us, whereabouts are you based? Where are you working? Where are you at the moment?
So I work in Beverley for my dentist practice. I've worked there for the past 11 years now.
All right. And how did you get to the point of working with my dentist in Beverley? How did that all come about for you?
So I was working in general practice previous to orthodontics, and I fancied a change. I was quite unhappy with my own smile, and I wasn't sure what treatments was available to me, so I was quite interested in orthodontics anyway. So I applied for a role as a dental nurse in the practice. Luckily, I got in, and I've never looked back since.
All right. So did you actually know about the roles within dentistry before your treatment?
No, I didn't realise that you could be an orthodontic therapist. I didn't realise that was a role as a dental nurse you could progress into.
Yeah. And how did you find that transition working as a dental nurse when you first started? What was that like?
It's really difficult going from to the side of the patient to actually being in control of the entire treatment that you're providing. It's such a change. But within my role as a dental nurse in an orthodontic practice, I already was able to take impressions of the patient and do x-rays, photographs and scanning. So I already had that patient connection where I could speak to the patient, reassure them and provide part of the treatment anyway.
All right. So speak to that a little bit, because even within nursing, the sorts of roles that you carry out can be different from practice to practice. So what's different about working as a nurse at an orthodontic practice as opposed to, let's say, a general practice?
So in a general practice, I didn't feel like when I'd done my radiography that it was used as much. But in an orthodontic practice, we have nurse-led clinics. So the nurses will have their own set of patients in for that day, and they will get to do the full treatment. They see them for the start of the treatment. So all their nerves and all their questions are coming out on that first initial appointment, and the nurse gets to deal with that and reassure them and show them what we're doing and what we can achieve.
Yeah. Was your training different as a nurse working in an orthodontic practice? So, for example, I work in general practice. So photography, scanning, x-rays, that's not really the bulk of what the nurses will do. Just tell us about how different it is in an orthodontic practice and what. So taking the x-rays, taking the photographs, what is that part of? What's that doing for the patients and the clinicians you work with?
So in an orthodontic practice, we have to have records of the patient at the start and the end of the treatment. So in the practice, when I was a dental nurse, I was able to do the NEBDN radiography, the NEBDN orthodontic nursing. Within the orthodontic nursing course, it requires you to be able to take intra and extraoral photographs of the patient. So within the practice, we was shown how to do that and able to do it on all the patients. And with the nurses, having their own clinic just means that we get to utilize everybody's skills to the maximum, and it works really well.
So tell us about the nurses having their own clinic. That sounds like something different to what we're probably used to. What does a nurse clinic look like?
A nurse clinic looks like a lot of scanning. So we've got an intraoral scanner. So instead of taking impressions, we use the scanner to get the models of the teeth. They also take the photographs and x-rays under prescription. So their day will be a day of records usually.
Yeah. And so is that every single working day that there are these nurse clinics running? How are the rest of the days split as an orthodontic nurse?
We have a practice with 5 chairs in it. So we have a polyclinic. So one of the surgeries has 3 chairs in it. We usually have the nurses maybe working 4 days of the week on 2 of the chairs.
Yeah.
And we've got 2 therapists working and 2 orthodontists.
Yeah. So how long was it until you decided that you wanted to now get into orthodontic therapy, and how did that come about? Even thinking, actually, I want to move on and do something a bit different.
So as a dental nurse getting to see the treatments, all I wanted to do was be able to fit the braces and be more a part of it. So there was an opportunity that came up at our practice to apply to be a trainee orthodontic therapist. To be a trainee orthodontic therapist, you need someone to mentor you, so a specialist orthodontist in the practice. So a few people wanted to go for the role, so we applied for the role. We went to the Leeds Dental Institute to be interviewed, and I was luckily chosen.
Yeah.
So
Did you have somebody that was able to guide you through that process? How did you prepare? Because you didn't have a mentor yet because you were just applying for the role. So how did you prepare for the interview at Leeds?
So for the interview at Leeds, since starting at the practice, I'd done every qualification that I could possibly get. I'd done radiography, ortho nursing, impressions, scanning, photographs. I'd done a foundation degree for dental nurses. I'd done a BSc in health professional studies and a teaching and training level 3 award. So when I was going for my interview, I wrote down all the questions I thought I could be asked, why I wanted to be an orthodontic therapist. I wrote it down so many times so that I knew the answer. It just all came out. And I'm so passionate about braces and teeth, and I absolutely love working as a therapist now. So it's fantastic.
For people that are thinking, of transitioning from, nursing to applying for orthodontic therapy, what advice would you give? What would have helped you even more now that you look back on the process?
I think that if you're working in an orthodontic practice, that's the main part of it. Being part of the treatment and just putting yourself out of your comfort zone, from being more chairside to having your own nurse's clinic, being more proactive, discussing treatments with the patients, and just gaining more confidence and not being so shy or quiet or reserved.
I want to ask this question because I know one of the nurses I used to work with was thinking about taking it further with, orthodontic therapy, but she found that she had to really be in an orthodontic practice for it to properly work. How can nurses position themselves to get picked for an orthodontic practice?
Well, the practice that I applied for at the time wasn't actually advertising for a member of staff. I just put my CV forward and asked if there was any hours available. And they only had 4 days, and I was working 5 days at the time. But I just pushed for it, and luckily I was able to get the hours that I needed. And it's just about gaining the experience. The course is quite intense, so you need an orthodontic specialist who's going to be able to train you and support you throughout the year of the training.
Yeah. Did you start doing all the other further qualifications once you knew you wanted to do orthodontic therapy, or were you just doing those already and then you decided, I'd like to now apply for orthodontic therapy? What came first?
So I love learning. I don't ever want to stop learning. I think the minute you stop learning, you can never know too much. You can never do too many courses. So I think it's really important to keep your education up to date. And for me, I was already doing a foundation degree at the university. So when I got into the orthodontic practice and I found that there was orthodontic nursing that you could do, I was just interested to learn more.
Yeah. All right. So, okay, you passed the interview at Leeds. What does it now look like going forward from that point?
So going forward, the Leeds course is full-time for 4 weeks. So it's every day at the Leeds Dental Institute for 4 weeks. And then you would go to Leeds 1 day a month and have exams, and then an exam at the Royal College of Surgeons at the end of it.
Yeah. And then after that, what sort of responsibilities do you start to take on as you're growing in the role?
So once qualifying.
Yes.
So
So
once
what was the qualification straight after those exams you had done with Leeds?
So the exams are like practice exams every month to get you ready for the final exam. So it's a full year of in-house training, seeing patients as a trainee therapist under the supervision of the orthodontist at all times. And then once qualifying, you work from a prescription from an orthodontist.
Yeah. Do you remember your first patient when you're being supervised?
Yes.
What was that like?
Yeah, I felt a bit nervous, but my hands were shaking and I couldn't control it, and they were shaking for quite a while once I started.
Yeah. The patient survived.
They survived, yeah.
And okay, once you then had gone through the supervision process and the supervision time, and that you were now fully qualified to work independently, just tell us what a typical day has been like since then.
So since then, I get to fit upper and lower braces, different types of braces, remove braces, adjust them, fit retainers, bonded retainers. At the minute, I've been qualified 4 years now, so I see a lot of private patients. So I'm fitting a lot of Invisalign. So it's quite popular, the Invisalign at the minute.
All right. So okay, since you're the expert on braces right now, I want to ask. You talked about the different types of braces. So just for people that have never really come across different types of braces, can you just let us know what that involves, choosing between different types of braces?
So the different types of braces that we have, usually it would be on the prescription of the orthodontist. So from the treatment plan, what they've discussed they'll be having. So we do metal braces, ceramic braces. We do self-ligating braces, so we don't add modules to the brackets. They've got gates that close. We also do a brace called Iconic, which is like a rose gold colour. And we do a lingual brace on the inside of the teeth, and then Invisalign.
Yeah. So I guess in terms of the fixed braces, between the metal and ceramic, well, I can guess what the patients probably prefer. But what do you prefer placing and debonding when it comes to metal or ceramic braces?
I prefer debonding and placing the metal. With the ceramic, they're quite bulky, and when you're removing them off the teeth, sometimes they fracture and crack, so they don't make great noises.
One thing that people get hung up on is what color bands should I choose? Do you ever have that talk with your patients about what could work well or
Every
what color
day.
to avoid?
Every day. We never choose white because it stains so much. Popular at the moment is navy blue.
Navy blue. Why is it popular?
Everyone wants navy blue. It's not my choice. I wouldn't choose navy blue, but everyone wants navy blue.
I once had a patient who was fixed braces, and she used to do two different colors, alternating two different colors. So do you have a limit to where you say, okay, this is as much choice as you get, or do you let them go wild with it?
Well, it has to be two colours because otherwise the nurses get a bit passing you the modules, they get a bit confused. Even with the two, they're like, which one do I need to give you now?
Yeah. So you mentioned the lingual brace as well. Is that something that you place as well?
Yeah, I've fitted a few of the lingual braces now.
All right, because they just look like a nightmare to fit. How is it trying to fit? Okay, so lingual braces, I guess for those that don't know, they're the braces that go behind the teeth. So they're still fixed to your teeth, but because they're behind, you can't see them. But it doesn't make it easy for the clinician to place.
Yeah, I feel like I'm upside down when I'm trying to fit the brace.
Yeah.
They're a good brace to fit, and my concern was that they would irritate the tongue. But a few
Mm.
patients that I've had in, I've said, "Oh, have you had any irritations, any problems at all?" And they're, "No, fine." And I'm really surprised by that.
Yeah. Would you say that you have a decent mix of extraction cases and non-extraction cases? Are you finding that there's an equal amount of people that are needing some teeth to be taken out to have their treatment work out well, or do you find that there's not much difference between extraction and non-extraction?
There's not much difference really. We have quite an equal balance. The
Yeah,
orthodontist I work with sometimes just likes to line everything up and then decide. We're never in a rush to extract.
yeah. All right. So the therapeutic alignment. Okay, so there's the fixed braces, there's the lingual braces. Um, did you mention something else before we went to aligners? Is there anything else that you're
Iconic.
thinking? Iconic, okay. So just talk to us about that. Why would that be an option that you might want to go for?
So we've not seen it being that popular, to be honest. But they're a rose gold coloured brace, so they're more
Mm,
tooth coloured,
yeah.
if you like. Which they look nice, but they're just not being as popular.
Okay. So it's just a matter of preference that
Yeah,
people are preferring some of the other ones. Okay. And then aligners, do you have different brands of aligners, or is it Invisalign that you're using as an aligner system?
mainly we use Invisalign. We have used Smileline a few times,
Mm-hmm.
but mainly Invisalign. We do Invisalign for adults and teens.
Jeans. Okay, so you said that you started doing the Invisalign fits a lot more recently. How was that transition from being so used to fixed braces to now moving to aligners?
I was always unsure about Invisalign because I'd not seen a lot of it, but I think there's a place for every treatment.
Yeah,
Patients have their lives and what they expect from braces and how straight they want their teeth. So I just think there's a place for all different types of braces depending on what the patient's expecting.
yeah. But I mean, how did you find the process of now getting to place, I don't know, aligners, attachments, IPR? How did you find that transition to now working with aligners when you were so used to working with fixed braces?
Um, Quite good actually. My orthodontist showed me everything what I needed to do to fit to fit an Invisalign aligner. I also attended a course with Invisalign
Mhm.
for therapists just to show me what materials they use and um, the process. And that chewies are really important for the patients to bite down on.
Yeah. And do you find that people are wearing them for as long as they should? Do you have that bit of a back and forth with patients about wearing them for long enough?
Sometimes it's mainly if I ask the patient, so have you been biting down on the chewies? And they say, yes. And I say, every time. And they say, oh, not every time. So it's just that really. It's not really the wearing of them. It's just
Yeah,
making sure they're in the right position mainly.
yeah. So, okay, the patients that you see, let's say it's for a fixed brace. When do you next check in with them, and how does that patient journey go?
So we usually see the patients every 6 to 8 weeks to adjust the wires or the brackets. Unless there's any problems before then, every 6 to 8 weeks.
Yeah. And the orthodontist, so they'll have come up with the plan. Is there another point where they might check in or see the patient, or is it towards the end? How does that work?
The orthodontist sees the patient every other visit.
Every other visit, okay, to track how things are going.
Yeah.
And then at the end, with the actually, it's better coming from you. How does it end? How does this patient journey end?
So once all the brace is removed, the patient has final photographs and scanning for retainers to be made. So the retainers are made and then fitted. They're advised to wear them when the orthodontist suggests. We then see the patient over the next year in the retention stage, because for us it is the most important part.
Yeah, yeah. Nowadays we say retention is for life, as long as you want to keep your teeth straight.
Yeah. And
Yeah.
people still feel shocked about that when you say your retainers are for life. As long as you want your teeth to stay straight, you've got to wear your retainers, and they say forever. And you say as long as you want your teeth to stay straight. So
Uh, and what would you say are your highlights of working as an orthodontic therapist?
just seeing the patient come in and being quite nervous and not knowing what to expect and being quite frightened and had horror stories from the friends, seeing their journey and them growing confidence and coming into the clinic and leaving the parents in the waiting room and becoming more of an adult. And at the end of the treatment, when they have the brace off and they've got this perfect smile, it's just completely worth the time that the parents have brought them to their appointments for.
Yeah.
It's just so rewarding.
Yeah. And I guess the majority of the patients that you're seeing, are they mainly children and some adults, or are you finding that it's becoming more adults that you're seeing?
It's mainly becoming a mix of both now.
Mm.
When I was a dental nurse, I was a treatment coordinator as well, and I designed a poster to say, did you know you could have braces at any age? Because I found that a lot of people, parents were saying, I wish I had braces when I was younger. So I
Yes.
wanted to let them know, well, you can have braces now. So
Do you know what the age of the oldest patient you've treated is?
I think the patient was 76.
Okay, so age is not a problem when
As
trying
long as
to
your teeth are
train people.
healthy and your gums are healthy, it's not a
Yeah,
problem.
fantastic. And at the moment, okay, you said, is it the past 4 years you said you've been working as an orthodontic therapist?
Yes.
And how many years were you working as a nurse?
7 previous to the in the practice.
All right, so about 7 years as a nurse at this practice, and then 4 years as an orthodontic therapist.
Yeah.
So, what are some top tips that you'd give to working as an orthodontic therapist?
Top tips that I'd give, that you need to be patient and you need to make sure that you explain the treatment and why the patient is offered a certain type of brace. Because I think if the patient doesn't understand the plan,
Hmm.
then they're not necessarily going to wear, if it's a removable brace, they're not necessarily going to wear it. They think that they can just leave it in the box and come back to the appointment and think it's working.
Yeah,
So I think it's important that the patient knows what the brace is doing so they can check and keep an eye on things as well and just be
yeah.
more involved.
And I mean, it seems like you get involved in quite a bit because you were doing the treatment coordinator role. You've done nursing as well, and you're quite active as well. So, has that always been like that for you? Really getting involved in different areas, or is it something that you've developed as you've gotten older?
Um, Probably in the last time that I've been working in the practice, so over the last 11 years, I've just been getting more involved in the treatments. I quite enjoy training the nurses. The
Yeah,
nurses, when they're doing their orthodontic nursing qualification, need to be able to trace x-rays. They need to be able to learn how to take photographs and complete their case studies. And I'm always willing to help them learn how to do that. So I think it's important that the nurses are more involved in the treatments as well.
Yeah, love it. Okay, so if you could just give us like a timeline for someone who is maybe in college and they want to get to where you are. So they're thinking about what subjects should I choose? Maybe let's start even at GCSEs. You know, does it matter which subjects I choose? You know, A level. You know, let's start from there. GCSEs. What should people be thinking about from that stage?
So for me, I went to do my dental nursing not straight from college. I did a nursing qualification first at the college. So when I went to do my dental nursing, the qualifications were my GCSEs that I needed, and that was all. For my orthodontic therapy, they require 2 post qualifications, so oral health or orthodontic nursing or radiography. Just 2 post qualifications that you've got behind you to be able to apply for the course.
Yeah. And then from that point, you then apply. You apply for the course. You then get a mentor, and then it's just, is it different competencies that you get required to complete to then becoming fully qualified?
Yeah, so it's different treatments that you have to complete under supervision of your mentor. You have to have so many hours within the clinic. So it has to be full-time hours under the supervision of a specialist orthodontist at all times. And then you go to Leeds and you go there once a month after that for the full year until the end of the course where you'll do your full exam.
All right. And then one of the things, well, how I actually got to hear about you was on Instagram. So one of the messages, the comments I got on a video was, can you interview an orthodontic therapist? So I was typing orthodontic therapist and your name came up. And then I got in touch with you. How did you start your page?
Well, I just thought not a lot of people know what an orthodontic therapist is, and I wanted to show people what we do and what qualifications we've got. So I just started posting from where I started, and then I kept looking at my page thinking, I'm going to delete it. It's cheesy. No one's going to like it. But the messages I get on it and the message I receive from dental nurses and other therapists saying that I really love your page, you've inspired me, I want to learn more. It's great. It's great just to inspire other dental nurses and have messages with other clinicians.
Yeah, and just let us know that the tag for your Instagram handle.
It's at diary of an underscore of an orthodontic therapist.
All right, and I'll put that in the description as well for people that want to message you, connect with you, and see all the great work that you're doing. But no, thank you for coming on today.
Thank
I
you.
think it's going to really help people that are considering the career, the pathway, and they'll be able to gain a lot from all that you've said today. So thank you.
Brilliant. Thank you.